This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Quick medical minute on a case that we had, and it's been a few weeks now, but basically it was a gentleman came in from a nursing home, kind of concerned for sepsis, kind of all the bad things going on with him. He was hypotensive, hypoxic, febrile, altered, and he looked like a pretty chronically ill guy. He had a feeding tube that he got most of his nutrition through the feeding tube at baseline, previous strokes, or previous debilitation, and so we started doing the workup on him. Some of the stuff we started getting was point of care labs, and a lot of his labs actually looked okay. His kidney function looked all right, but his sodium was 165. So, normal sodium should be up to 145, and then sometimes we see sodium's a little higher than that. 165 is pretty high. And hypernatremia is probably not as common as what we see a lot of low sodiums. We see a lot of hyponatremia, which sometimes is serious. But hypernatremia, does anyone know what the main reason someone would get that hypernatremic or hypernatremia in general would be? Why do people get so high on their sodium? What's it? Hemoconcentration, yeah, and specifically, not getting enough water. And the most frequent reason we would see this is someone like this patient who's debilitated, dependent on either getting water brought to them or specifically someone who gets feed tubes and is not getting enough water. So it's hard to know exactly why this patient became so hypernatremic, but it's probably from not getting enough water, someone that can't get up, drink water when they're thirsty, isn't getting enough water via their feedings. And one of the things that was challenging about this patient is that he was hypotensive and tachycardic and seemed septic, so our rushes to give lots of fluids. But the problem with hypernatremia, besides the fact that it can cause altered mental status and serious changes in neurologic condition, is you can't correct it too quickly. Does anyone know what happens if you correct hypernatremia too quickly? So it's not everything in his brain, and it's not necessarily seizures. You can get cerebral edema. You can get really bad cerebral edema that can be kind of irreversible. And just as kind of trivia, does anyone know what happens if you correct hyponatremia too quickly, if you bring low sodium up too quickly? So it's kind of similar to cerebral edema, but you get really bad demyelination of your brain that's also irreversible and really damaging. So both really high sodium and really low sodium we need to correct slowly. So we couldn't give this patient lots of fluids quickly, because you give them lots of fluids, it'll change their sodium very quickly. So it's a little bit of a balancing act of giving him some fluids, but not too quickly. So you have to give slow fluids, depending, how hypernatremic you are. Sometimes you do just regular normal saline because that's less sodium than what's the 165. Or sometimes you do like a half normal saline with D5 and you give it slowly, like, 150 to 200 an hour. You can kind of calculate that, but you don't want to do just big bolses of fluids. And you need to check the sodium fairly frequently to make sure you're not overcorrecting. So sometimes you need to check sodiums every 2 or 3 hours to make sure you're bringing it down slowly. So it's definitely something that's difficult to manage. Patients need to go to ICU for close monitoring of their electrolytes, but something we don't see that often. Definitely need to be aware of the not overcorrecting severe hypernatremia. All right, thanks everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.